Can you guys hear us okay, Laura? Dave?
Yes, we can hear you.
Okay, we can hear you just fine, I think.
Yeah.
We may have to repeat for the public, but this is what we'll do.
What's that? Finish our agenda. Yeah, we're
So,
So we'll call this meeting to order of the Broadwater County Health Board. We'll bypass our normal, agenda and go to our coronavirus 19 subject. I think, Sean, do you want to kind of lead us through this thing?
I will try to lead us through this. I think most of the public is most likely here to hear us discuss the restaurants and licensed establishments, so I think we should probably just move straight on to that. Let's first just kind of introduce ourselves real quick. I'm Sean Rowland. I'm the intern sanitarian for Broadwater County. We have 3 members of the Board of Health here. Well, Laura Obert is on the phone right now, and Daryl and Mike are on the Board of Health. And then Dr. Campbell is our health officer. He's sitting over there in the side. And then Teresa is here, and Teresa is our public health nurse. And Helen Coleman is the admin help for the environmental health office. So we're the folks that are trying to help the community kind of move forward in this time of crisis. So let's start with what we're thinking in terms of restaurants, licensed establishments, and how we want to proceed. We have been given some recommendations from the state of Montana, and we've been also given some recommendations from the federal government. And most of these recommendations are, they're not, very specific to our community. They are very, they're specific to, the United States, and then the state requirements are also just kind of very broad. So what we are having to do today is discuss how does Broadwater County deal with this situation specifically to our county. And so there's probably going to be a lot of discussion about this as we move forward, because this is a novel situation. We've never been through this, and we just need to take it slowly, surely, and make sure that we cover our bases here, because we're really looking at the public's health here. So just last night or this morning, we received information from the federal government saying that we need to look at the next 15 days to slow down the spread of the coronavirus. And this recommendation is from, came from the president's coronavirus guidelines, or the group from the president. And in terms of the discussion for bars, restaurants, and that, it says that in states with evidence of community transmission, bars, restaurants, food courts, gyms, and other indoor and outdoor venues where groups of people congregate should be closed. Now, with that being said, that we are not in an area that has evidence of community transmission. It is undetermined at this point. So we're in the gray, and this is what we're going to be talking about a lot today, is we're in the gray right now. We are there. So with that being said, that's starting at the federal level. The recommendations from the Department of Health and Human Services, and that's who the restaurants and licensed establishments get their licenses from. They have some very specific guidelines for grocery stores, restaurants, and taverns, and then public gatherings. At this point, their recommendations are only indicating that the restaurants, if they take guidance from the local authority, and that is us. And so I think you've obviously seen that the surrounding counties have already put limitations on restaurants and bars and casinos, of course. When I say restaurants, I'm meaning all of those. So what we want to do now, I think, is we want to discuss some recommendations on how to move forward. My recommendation as the public, as the sanitarian, and I think we'll want to see what Teresa and then the health officer has to say, is that we that we do have some limit, we limit the ability of restaurants to provide, not limit their, their ability, but we want to most likely close the restaurants other than for takeout, delivery, and that type of activity, so that we can limit the amount of contact, you know. Obviously, this meeting right now is too many people, and it's, you know, it's nerve-wracking just being, we're all in this kind of situation now where there's this cloud over our heads and we want to get through this. But, so that is my recommendation, and basically the recommendation from us is putting something from the Board of Health and the health officer that indicates something similar to what Silver Bow County put in their declaration. And I'll just read it out loud, and then I think it's time, then we can start discussing how to move forward. And if we need more information, we can, you know, go forward with that as well. But here's what their declaration says. It says, all bars, breweries, distilleries, casinos, restaurants, and gyms, with the exception of drive-through, delivery, and pickup services within the county, shall be closed to the public, and then they put some dates on there, pending further notification. So that's my recommendation as well. We do not want to stifle business in this community. People who have businesses here, it's very important. It's actually vital to our community to be able to provide food to people in this community. I spent yesterday working with the grocery store to talk to them about how to keep their employees safe, trying to get more information from the state on how to keep their employees safe. Same with Town Pump. Because right now Town Pump and Family Dollar and Bob's Market are vital to our community. That's where we as a community will obtain our food. And so I've spent the last few days getting recommendations for them and working with them. So now it's kind of time to move to these licensed establishments and give them some recommendations as well. So I guess right now I'm going to open it up and see, Mike, who's the head of the board? Mike?
I am. I think we would have Doc give us some input for what he thinks we ought to do here.
What I think, I'm concerned about the financial stress it's gonna place on, they're closing all the restaurants and bars and stuff, it's gonna place on the community as a whole. I'm concerned that we're losing so much industry in the county that's something that can't be ignored. And I think I would like to hear the mayor's expression on what he thinks about the restaurants and things. You know about the virus, everybody knows about the virus. I wonder what your feelings are.
Well, I mean, I do feel like it's, I think we're faced double here, as we do have a lot of elderly people living in Broadwater County, and in the city for sure. A pretty good percentage of our population. I'm not against, the bars and the restaurants, but I think somewhere along the line, we have to shut this thing down before we have a real epidemic. And that's kind of where I said it. We don't know how many days yet, we just keep going until we hit another mile marker, right? And then we go on, or is there any idea how long this is gonna be?
No, there really isn't, and, it's one of those things that we have to take day by day. We get hourly information from the CDC and from the state, at the public health office, with recommendations. So I don't think that we can't just put a date on it. We hope that it'll be just like the flu, and that it'll just, kind of run its course and be over with. Or it could turn into one of the biggest natural disasters we've ever had. So, you know, we have to be prepared for that. And, you know, now they're talking about straightening out the curve. So, you know, basically, if we don't all do it, and, you know, if only 50% of the people do it, it's not gonna work. You know, it pretty much has to be across the board. And as much as I feel for all of the people that are going to, you know, suffer from this, you know, there are some programs out there to help people, you know, unemployment, small business loans and stuff like that. You know, so the government's doing everything they can to help people out. But I think that if we don't do something and we're right in the middle of, you know, everything in Bozeman's closed down, everything in Lewis and Clark is closed down. If Townsend doesn't follow through with that, I think we're dropping the ball. That's my opinion.
Yes,
If I can, you know, what she's saying is exactly right. I think if you watched in the Independent Record or KXLH last night, you saw everybody was transferring from Lewis and Clark or Bozeman to areas that were still available to go into restaurants, bars, and what have you. So in the south end of our county, one of our fine establishments down there, the parking lot was jam-packed at 6 o'clock last night because no one could go into a facility on St. Patty's Day in Bozeman, so they went to Teasers instead. When you look at everything in Montana City Grill, everybody on Lewis and Clark was going there because the fact is they still have the ability to operate. So what she's saying is exactly correct. We're stuck between two areas that are locked down, and if we don't do something, not that I'm a big proponent of closing everything down, but everybody's just gonna transfer their issues over to here. And exactly what the mayor said is that we have a very high populace of elder folks and some at-risk folks, and we don't, there's only so much we can do, and that's my concern is that we have a small hospital, St. Pete's, I think they've already got restrictions, Bozeman Deaconess already got restrictions, so we have to be mindful of that, not try to create more pandemic or people to stress out, but we have to look at what's best for the public to get through this and get going, and you know, I have lots of concerns about people being locked in at home and being locked out of their normal everyday lives because it causes a different problem for me. Which then causes a problem for the jail and the justice system and everything else. So I'm on the fence as well, but I think if we don't do something to protect ourselves, there's people out there, and it's apparent, if you watch anything on Fox News or social media or whatever, the gal that decided to do the coronavirus challenge by licking toilet seats on an airplane. There's people who just can't fix stupid. And that's, you know, that they're all over in our society, and if people are gonna continue to do things to put other people at risk, then we have to do something to do our very best to keep people safe. So, you know, some of the conversations I've had with some of the business owners, they do understand. I like the idea of still having the ability to go pick up food and have food delivered, but it really comes down to people want to die, then go in the hills and do it yourself. Don't take everybody else with you. And that's just my firm belief on this, and because I think that if we can't control people's panic, you know, we're gonna have to do something different, so, and that's kind of where we're getting. If you walk into Bob's, you're gonna see that shelves are getting pretty barren, the truck drivers are going as fast as they can and everything else, but people are scared and we need to control that as well, so that's my 2 cents on that piece.
So just to give you an update, we do have one positive case, I'm sure that everybody knows that. We also have 2 people under investigation that have traveled. And so, as Sean said, there is a list of, you know, recommendations for all of these facilities on cleaning and all that stuff. The problem I have is, you know, I have a small staff, Sean's the only one in, you know, in the sanitarian position. Who's gonna monitor that? I mean, we are all doing as much as we can, and our days are swamped. Because if you give somebody a document that says you have to do this, this, and this every day and after every person and all that stuff, who's gonna monitor it? So that's the problem I have with that, for any of you guys that have food service in town. I just don't think that we have the staff or the capability to monitor whether those things are being carried out.
So are you wanting to close down all small businesses?
Pardon me?
So I said, so are you wanting to close down all small businesses?
I think that we should, personally, I think that we should, do carry out, that's what everybody's doing. In most of the other communities, you know, they haven't closed down their carry-out services at all. It's just the in-dining.
Okay.
So this is where I'm concerned. You've already expressed that everyone's going to these other areas. So you still have people going to those areas, coming back to our community. They still have point of contact in our grocery stores, our pharmacies. Even though you're shutting down restaurants and bars, we still have all of those points of contact. You also have not talked about any kind of a plan about what are we gonna do to slow it down or stop it? Are you gonna just shut them down indefinitely? Is this 30 days from now?
That's
mean,
what we're
that's-
here for.
But that's what it could lead to,
Right.
honestly.
And we talked about that a few minutes ago. We don't have a time frame.
Correct.
And so we have to follow the guidance that we get from the state. Really, it is all about following the CDC and the state guidance. Because we just can't willy-nilly make decisions, based on our own feelings. Or, you know, we're a small community, everybody knows everybody knows it's gonna be a hardship for everybody. And right now, Lewis and Clark is only closed down till the 23rd. When this initially came out, it was for 2 weeks, so we're a little bit behind the ball to begin with. So,
They've also set up things that they have to do now to open.
right,
And so but we're still skipping the whole thing of people are still leaving our county and coming back to our grocery stores, our Family Dollar, we're
Right.
still not slowing it down there.
but that's everywhere. You know, I mean, we have to do what's best for our county, and we can't make those people do that. You know, we can't say, well, you know, Jefferson County doesn't have this or doesn't have that. We have to think about what's best for our.
Right, but what can we do here to help? What can we do with our community to help that? Does that mean we need to limit how many people go into the grocery store at a time? Do we need, that's what I'm asking, are there things we can do so that we are not having this many people in a room like this?
Right,
There's restrictions now where the restaurants that do open have to have so many feet between their tables and not so many people in the restaurant. They're still, and then they have, like you said, the cleaning requirements. As far as monitoring it, we all have to take responsibility. We do.
right. And those are the decisions we're here to make today. So, you know, a group of us could have just made those decisions, you know, and enforced them. But, you know, we wanna hear what the public has to say, so we can make the best decision for our county. So, there's gonna be a lot of education. I just started working on that this morning. I think that, I've been out of town, and so it's, you know, Heather hasn't had time to do a lot of education, so, that's one thing that we're going to jump right on, is community education. Once we decide what we're gonna do with the, you know, restaurants and stuff like that, then we'll move forward with what needs to be done there.
Yes, when,
Thank you, Mike. You know, one of the things in regards to what Ms. Hartman just said about restricting things, in the same breath, when you're making your decision, think about who's gonna enforce that. If we say Bob's gonna have 25 people in the store at one time, that includes the staff that's probably in it, right? But who's gonna be the one standing at the door to enforce that, okay? This isn't the LPD, it's not Lewis and Clark County, we don't have a plethora of people to stand at the door and say, you're number 26, you're gonna have to wait. So, you know, rely on the fact that the sheriff's office isn't gonna be able to go and stand in front of these businesses to control access. So that's a conversation with those business owners of who's willing to go stand in that door and control that movement. What's it look like, you know, again, people coming back and forth from Helena, everybody's running to Helena. I know they're limiting 50 people into Costco right now. So you stand at the door, you wait for one to come out, which is foolish because it doesn't sound like there's anything in Costco in the first place, so but people are standing in line to go look at empty shelves. So, you know, think about some of those and make a plan, and I agree with the aspect of how long does this go. You know, I get 50 emails a day in regards to coronavirus and how it affects things and the numbers and how it's going to change. And I do pay attention to the numbers. So if you look at Friday, there was 1,741 cases of coronavirus confirmed in the U.S. By Sunday, when I'm sitting at my desk, there's 2,952. Now we're up to 7,500. So it is jumping quite rapidly. And at some point, those numbers are going to continue to grow if people don't start taking precautions in their own ways and doing some of their own self-quarantine versus going out into the public and affecting other people. So, you know, it's going to, those numbers are going to continue to grow in a rapid fashion for a period of time. I think that's what this is about. So if we're going to look at slowing it down, if we're trying to straighten the curve, let's straighten the curve. Let's give it 15 days, and then we'll come back and evaluate the situation as we can. Understand the fact that if we can't stop the pandemonium going out there, there's no point in going to the grocery store or Family Dollar or Town Pump or anything else because there ain't nothing left. And you know, President Trump did release the requirement on how many hours a day a truck driver can get around. So hopefully that will help us get supplies here quicker. But people need to calm down and just take a deep breath and go, you know what, this is a virus. We can't control it. The government's not going to fix it for us. Okay, it doesn't matter. Local level, state level, federal level, no one's going to fix this problem. This is just something we have to be able to take precautions and work through on our own. So that's just some of my guidance in regards to that. If you are looking at restricting access into those buildings, who's going to be the one enforcing it and who's willing to do it? We saw fist fights across the nation over toilet paper. I'm sure we'll probably see fist fights over bananas next, I guess, I don't know. But that's people panicking over this is creating a different dilemma for us as well. So that's just my input on that piece. So.
Thank you, Wynn. Kathy?
One thing I have seen throughout a few of the other counties is the businesses were given an option to either stay open with restricted hours, or close. You know, they left it up to the businesses. You know, I understand most of our businesses here in town, we could all go to takeout, you know, and limit the people that are in the building. But you know, for those that are like small business owners, the Fishtail's got new ownership. You know, they, God, which one was it? Anyway, a different county had limited access for bars, casinos, you know, only open for like 5 hours a day. Because it still gives enough profit for those people who can't file for unemployment because they own a business. You know, it gives their employees a way to at least earn a paycheck while their kids are at home so they can afford food for their families. You know, it's just different options that I've seen different counties apply to their area. You know, you restrict it, there's still a restriction there. It's just not as, you know, open from 8 a.m. to 2 a.m. or it's not open from, you know, 10 to 10. It's just restricted. I mean, it's an option. We have a small enough community. We could do it, and everybody still doesn't have to worry about being broke and not being able to afford food for their kids for the next 2 weeks. We're all stuck at home trying not to kill each other. It's just an option.
Excuse me, could you please have the public state their name for the, we're Facebook Live and videoing on YouTube, and we're getting some questions on commenters here.
Corey?
So, I'm Corey Swanson, County Attorney. I just want to give you an update. We just came from a meeting with the courts, and so we did it by VisionNet. So it's the First Judicial District Court, so us and Helena, and how they're going to operate. So they're not closing courts down completely. Their judgment and will issue an order in the next day or so that all jury trials will be pushed to after May 1. Okay, if it's a bench trial or an essential hearing, they will stay on track and we will still have them. But all jury trials will be moved to after May 1 because we just don't see any way to get a jury in here that's in a way that's compliant with the health recommendations. It's just not going to happen. There's going to be some. Basically, if it's not an essential hearing, no matter what kind of case it is, criminal or civil, we're either going to do it by, some things we can just file papers and not have a hearing. Hearings may get delayed, or VisionNet, or video conference, or phone will be the way we do it. also gonna be doing a lot of, I think, and the sheriffs have already implemented this, kind of an adjustment on who's in jail. And basically there won't be arrests unless it's a violent crime or a DUI where they're still intoxicated, things like that. Felony arrests will pretty much proceed as normal, but I will tell you that we're all, if someone's on a felony where it's not an urgent deal or it's, we're waiting on pretrial, and we can get them out of jail safely, we're doing it. What I would expect, what I would say is, what I'm hearing from the courts is that we cannot shut down everything, and there's no expectation to do that, but we are taking all the measures we can to limit the number of people that come through. We may be limiting, say, family members who accompany someone to court. They may not need to be in the courtroom, and so we just ask them to wait outside. They're having the same problems we do. They had a big problem this morning and yesterday with a whole bunch of people congregating in the foyer in the courtroom and not listening to guidance that says you need to separate. So I am a little surprised at this meeting. We're breaking all the rules right now. There's like 60 people here and we're practically sitting on each other's laps. So I would just say my recommendation is a policy where things are not ground to a halt, because that's not possible. But we're doing kind of a modified prioritization as much as possible. The other thing I would say is, this is an interconnected world, and people are gonna come up and down that highway. And I think the idea that we can prevent someone from Butte or Helen or Bozeman or Hong Kong from coming here is gonna be hard to do. I think this thing's gonna last longer than we think, and I think the economic effects are gonna be significant. We need to have the ability to restart all these wheels and these engines when we finally get over this thing.
And shutting everything down, but
So this is Sean Rowland, and I do want to say, you're right, this is a dynamic situation. We could be back here tomorrow with a totally different set of recommendations from the CDC. We could be closing down everything, or we could be opening everything back up within a week because the miracle drug came along. I mean, we just don't know. And so we have to start somewhere, and we have to be prudent about what we're doing with the understanding that it could change immediately. And so I think that the guidelines that we received from the federal government was, let's take the next 15 days and see what we can do based on, so I think that's the window that we're looking at, the timeline we're looking at. And that would take us into, I think, April 2nd is what the 15 days from now would be. So based on that, I think we know what our window is, but so I think we need to have some recommendations or a decision on what we should do and to what extent. And it is something, I understand, just like I'm hearing, I hadn't heard that some restaurants were able to come back to any of the counties. I haven't seen any of that information, indicating, well, if we space the people out to a certain extent, that they can reopen. Those are things that we can look at as we progress, but we need to do something now. And I'm not saying I don't want to shut down a small business. I'm a small business person. I understand it's hard. But we need to start somewhere, and then we can start refining how we do it, and we'll have a better understanding of how the virus works. We're still trying to figure out the virus itself. So I don't know. Dr. Campbell, after hearing all this information, do you think it's prudent to do a limitation, allow the restaurants to stay open if they do delivery, or people come and pick up, that type of
I
thing?
think delivery and pickup would be reasonable to do. I can't justify bars though. I just can't do it.
Right, so pick up.
So the recommendations that I received, as far as places that we need to look at, are churches, breweries or distilleries, casinos, restaurants, any kind of gym or workout places, those are the kind of places that we have to look at where people congregate and are in, you know, close quarters. I don't know if you guys have had any other information, but this is the information that I received. So the restaurants can do, drive-through or pickup.
Or delivery.
Or delivery, correct. The limiting the
Provided
amount of
they
people that
take
go
what sort
into
of
the store,
sanitary-
I don't know how that would work.
Sorry, Peter Simon, city attorney. So drive-through, takeout, but with what sort of sanitization procedures are you recommending?
Well, standard protocols for restaurants like are already in place. I mean, the COVID-19 is no different
Sure.
than all the diseases that we try to prevent. So basically, in the sense of the workers in place preparing food, how they prepare the food, all those standards still remain the same. Temperatures have to be followed, hygiene has to be followed.
Yeah.
If a person's sick, they're headed home, you know, that type of thing.
No, I'm referring to like the additional point of contact, like that involves with, you know, takeout or.
So it's same thing, you still have that, so the takeout, it's going to have to be, the transaction will have to take place, hands washed,
Right.
sanitized, that type of thing. And so
Okay.
we can also provide some recommendations for that, but absolutely, I mean, that's,
Okay.
you know, there's that one point of contact, and we already have that
Sure.
situation, and so, we should already be, those,
Washing.
yeah, washing
Right.
hands.
Yeah, it shouldn't be anything new.
So,
So,
um,
Angie Wintro, I own Mighty Moose Bakery. So just because we hadn't had this conversation yet, and I have a lot of traffic that's coming through town that stops at the bakery, we are currently bleaching all doorknobs, all doors, every hour. All my staff at all times is wearing gloves, they're changing gloves through every single customer. The majority of my business is a takeout situation, so, it doesn't affect me. So we've already not had people, as of this morning, sitting down and dining in. How many people are we allowed to have in the lobby? I fortunately am extremely small, so like I can stop them at the door, and we've been trying to limit it to like 10.
Right, I think that would be my follow-up question, is if you're going to do some sort of, remain, for some of these businesses partially open, and I'm really thinking like bars or restaurants, and, you know, what metric are you gonna use as far as, you know, one in, one out, or how many, is it like a person per so many
Well,
square feet?
the limit is, or the recommendation is 10 people in a space.
In what space?
Any space.
Any space?
Yeah, I
Not,
would,
not based on square footage? I mean, cause you could have 10 people in a 1,000-foot, you know, warehouse.
that's correct, but we have to, none of our restaurants are that way, right?
Yeah, right, so that's what I mean, is there any meaningful metric where you could actually justify like a one in, one out situation for certain types of these places, or is it just going to have to be, you know, if you don't have a takeout or delivery option, then your business needs to close?
Right, we're talking about takeout, delivery,
Right,
and pickup.
Right.
yeah.
Yeah, that's what
And
The
we're
if
other
you
thing
don't
that you have
right
to
now.
consider is the length of exposure, and that is one of the key factors with this particular virus, is that the length of exposure, obviously increased the risk. So if you're dining in and you're there for an hour, hour and a half visiting with your friends, that's quite a lengthy exposure. So, the quicker the better, and I think that's part of the reason that they are doing what they're doing as far as the restaurants go.
Yes.
I'm Elliot Colton, paramedic here, and I'd just like to talk about how flattening the curve affects us on emergency services on the hospital side. We have one ventilator over there, and we have 2 IV pumps. And we have excellent providers and good medics and nurses, but we can do really good care for 1 or 2 people. And we're talking about someone intubated or on a ventilator, it's 1 right now. And if we get 100 patients that need that over the 6 months, they'll all get excellent care. And if we get 100 in a week, they're gonna get very poor care, and that's kind of the lesson from Italy right now. So I do think that these seemingly draconian measures for 15 days especially, to be reevaluated, could ultimately get us back on the path of a more normal, sane life faster. Because I try to think long-term about these things, and if in a very aggressive response for 15 or 30 days, puts us back on track, ultimately a year from now, all those businesses, I believe, will be better off, rather than this lingering and going on 3 months, 6 months, 9 months. So I think aggressive early on is the way to go, because this board has the ability to dial all that back if deemed necessary.
You know, and to follow up on the ventilator issue, correct me if I'm wrong, but my understanding is that the majority of the deaths are occurring because of respiratory complications
Right.
towards the end, such as pneumonia, that would require services like that.
Right, and these kind of patients, if you get sick enough to be on a ventilator, your prognosis is very poor at that point. And so the smart money is keeping people from ever needing to be on a ventilator.
Yeah.
So.
If I can interject into that as well, just because I just think I like to talk, but I spend a lot of time reading. In regards to that, you know, when we look at this and exactly what he's saying is that there's only a limited amount of ventilators. I think St. Pete's has only got 5. You know, and so when we talk about this, trying to curb this, I know everybody don't want to change their lifestyle, but when we talk about businesses being impacted, well, if everybody catches coronavirus and dies, your business doesn't mean anything at this juncture anyways. So, with that also being said, when we're limited based upon circumstances and everything else, if we put 50 people try to put 50 people in this hospital with coronavirus, a lot of them are gonna die, which then we have issues with. Because the quality of care is gonna go down because we don't have the resources. Helena is not gonna fill up their hospital when they have a population of 90,000 in that county. They're not gonna take 50 of our patients and not worry about the 70,000 or 90,000 people up there. And so it's, what you're seeing basically the same as our jail environment. The inmates that are in my jail, they stay in my jail. The ones in your jail stay in your jail. And it's kind of that same concept, is everybody's kind of fending for themselves. So, you know, we gotta do something, as painful it might be, it's 15 days. I think my inmates would tell you 15 days is a short period of time. You know, so I've been in there for 2 years. So, without life, liberty, and pursuit of happiness, and they don't get to control when their toilet paper comes to them, we do. So, you know, I think that we gotta look at it from a humanity aspect, is that it's best for society, best for our businesses, best for our children and our elders, that we take this seriously and do the very best that we can. And if we're gonna talk about leaving bars open, then I think that, or bars or restaurants or anything of that nature, I think they would go in and say, this is how many seats you can have on the table. You know, if that's the case, you're gonna go down. If you're gonna leave a bar open, then you're gonna pull half of your chairs. Because that's all you're gonna get. If the chairs are full, then you're full, and you need to keep people out the door. Exposure's correct. I mean, there's lots of things that are going on, and we are learning about this more and more every day. So, my recommendation from, as being your sheriff, who doesn't have a dog in the fight when it comes to medical, is let's do the very best we can with a short period of time and see if we can slow the shit down. So, that's what I have.
So, Bobby Meehan, Broadwater reporter, will you clearly define your recommendations?
So I have it written here, and I have some recommendations. Here's the last one that I gave. Should just have, let me see what you've got there.
This one?
It would have been, it's the right there, right? Yeah, hand that to Bobby. And basically, so the recommendation says, and this is just my recommendation, this can be all changed.
This was just this, I know, I didn't copy it.
Let me have, you hand those out, but hand me one, please. Let's give a couple to the, you guys compare these. And then I'll just read it out real quick. It's all bars, breweries, distilleries, casinos, restaurants, and gyms, with the exception of drive-through, delivery, and pickup services within Broadwater County, Montana, shall be closed to the public effective at 8 p.m. Wednesday, March 18th, 2020, through Thursday, April 2nd, 2020. Probably maybe need to put a time on that, you know, on the April 2nd. But that is the recommendation as I've written it. And of course, we can make that change if we need to.
So, Bobby Meehan. I recommend that maybe we put in here, or y'all put in here, or consider placing in here, you know, we come back in 15 days and it can be adjusted, or we lengthen it after a period of time.
Sure.
So what if
Yeah,
past
we
April 7th?
definitely have to, exactly, we can add some language in there that indicates that we will be reconvening prior to that date to reconsider. I think we're going to have to.
Yeah, yes, we would have.
Did you guys did anybody need copies of those? I'm sorry.
Nicole, do you guys?
I have a few questions from folks online whenever you're ready to take those.
Go ahead.
Okay. The first one, this is coming from Daylene Hansen. This is a question to the Board of Health and the Commissioners. If someone has tested positive for the virus and needs care, will Broadwater Health Center treat them or send them to a different facility for treatment? What precautions are being taken to keep our health center residents from being exposed?
So, basically, what all the guidance are saying, and I put that in the first, notification, press release, and I think it's in the second one as well, is that people need to call their provider first. What we did with, other ones that we've had that have thought they had the virus is make sure that they have a mask. We call the provider, make sure that they have a room specifically for that person. The least amount of medical staff that needs to see that person sees that person. They get them in and get them out. We currently have 6 test kits right now as of this morning to test for the virus. Right now, they're doing a quick test kit, and it, you know, there's a margin of error with those, but if it's positive, then it goes to the state lab. Since the state lab is close, you know, any of us can curry that up to the state lab and, you know, probably have those results fairly quickly. But they are still all being tested by the CDC as well. So there is, and then the providers have all had that teaching, training, whatever, from my staff and myself. And so they know, you know, what they're supposed to do when somebody calls. And I also sent out some information on screening, so if they get a call and they say, well, I've got a fever, I've got a cough, you know, should I come in and get tested, you know, for the virus, they have a whole protocol, kind of a checklist, if you will, of questions that they need to ask. And we're continually updating that information. We did send out information to the EMS, to the Sheriff's Department, and as the guidance comes out to us, then we get it out to the public. So, does that answer your question?
Elliott Cole Paramedics, so specifically for how the hospital's operating now, we have all of the usual casual entrance points that everybody's used to using are shut down, and we have access to the emergency room door only.
Correct.
And everyone that comes in, including me, including Mary, everyone else, we have to have our temperatures taken and recorded in a log. So we are controlling access, and that is the most consequential thing we can do right now.
Question, Nancy Wilson. So, if you do have the virus, and say you were to go to the hospital, would a regular flu test pick that up?
No.
No.
Okay, the reason I ask is because a lot of people back in October, November, December of last year had flu-like symptoms and had gone to the hospital and they were just told to go home, it was a bug. Okay, they all tested negative for the flu. So would that have been the possible coronavirus back in November, December of last year? Are we 100% certain of that?
We're not 100% sure of anything, but I would say a high percentage that would not have been a virus.
Did it last year?
Well, because of how fast it spreads, the eruption would have happened a long time ago. And there's lots of things, there's lots of respiratory viruses, like the common cold, that you can have bad colds that feel like a flu. And part of why a lot of providers don't test, because there's not a lot we can do for it anyway. So you just have to go home and rest. So it's kind of like a worthless expense for the patient, and it's just not worthwhile. So that's why it's not done. It's not out of laziness or anything like that. Yeah.
Well, the reason I asked is just because, you know, between my kids, and there were a bunch of kids that were out of school in November, December of last year, did these flu-like symptoms.
Right.
You know, and I have been told by numerous people that we've had the coronavirus, we just weren't aware that it was the coronavirus.
I said
There
it's unlikely
actually
to-
is a couple
So-
different strains of the coronavirus, and so that's where people are a little bit confused. This is a new strain, and that's why it's called a pandemic. But we've known about the other coronaviruses for many years, and they are actually being tested in our respiratory panel. So it could be that they would have another form of the coronavirus, but not this one.
Yes, Nicole?
I have another question online. This is coming from Desiree Bandy. She states, it's not just businesses with food. What about stores where people are touching products all day and trying on clothing, articles on their person, etc.?
Yeah, that's, you know, to me, that is a matter of personal hygiene. I'm kind of a germaphobe, so, you know, I use the hand sanitizer and the wipes and everything else. But there again, you know, right now they're not limiting people that are going into, I wanted to say Macy's, but they're not open anymore. You know, Walmart or any of those places where you're trying on clothes, that, you know, is a matter of personal hygiene. Really it is.
I have another. This is coming from Nolan Lister. He asks, the public health nurse stated she was out of town and that public education is something she'll jump right on. Does that mean no efforts were made in her absence to help educate the public in Broadwater County? Follow-up question, how many tests have been conducted locally that would demonstrate a lack of community spread Sean hinted at? And then I have a third question. Are the one confirmed case and the two under investigation being checked in on regularly, and how often? Have those who have been in contact with them been notified?
So the two that are under investigation, as well as the one that tested positive, are being checked in on daily. I don't know that my personal life is a matter of public knowledge, but I was not gone on vacation.
And I have been reaching out to the public for, or not the public, but some of the establishments, especially the grocery stores and that, for many days now. It's something that this has been a developing crisis. We've been trying to get the information put together on from the DPHHS, the state. We didn't get recommendations from them until early this week, and yet last week, other sanitarians and myself were hammering them to get us recommendations, because we are not in a position, we're unlike Missoula County or Gallatin County where they have full-time staffs that can handle this type of thing. We rely on the recommendations from the DPHHS or the CDC to help us with that, so we've been putting that information together.
So Sean, I feel like, Peter Simon again, I feel like I guess the main question just hanging out there, just looking at this recommendation right here is, you know, given the issues about enforcement, is there any really effective way to do a carve out for, you know, in restaurant or in casino patronage, and is it even beneficial to the public to even consider that? And it seems like, you know, going by Wynn's recommendations and, I'm sorry, I didn't catch your name. Elliot, it's not really the public health to consider that's such a carve out, but I know, speaking with different business owners, that they might like to still see some of that. I just don't know if it, you know, is effective or meaningful, if we can do something like that in an effective or meaningful way, and whether that, you know, compared to public health concerns is worthwhile even considering. It seems like the simpler, better, and, you know, this bold thing language should probably just, you know, I don't think it should be carved out personally, but.
What do you mean when you say carved out?
Well, when they say with the exception of drive-through delivery and pickup services, there's the discussion of some of these businesses like the casinos and the bars, can they still allow, 5 to 10 patrons?
Restricted seating.
Right, restricted seating, that's what I'm saying, seems to be the issue that's still hanging out there for some of these businesses. And my impression from listening to some of the, Wynn and the medical professionals is that really doesn't make sense. It makes sense maybe a little bit financially for these businesses, but from a public health perspective, it would be better just to have this as drafted.
So, my response is yes. I mean, I agree with that. I think it's very difficult for us to determine how where's the line for somebody to survive in terms of economically a business.
Right, how many seats do they hold?
How many seats do they need to have? I can't answer that, but I can comfortably, in my mind, I know that if we do this is a good start.
Right.
And it's where, yeah. I guess that's
And it's definitive and there aren't enforcement issues. And it's gonna suck, but
It's hard.
Well, too, human beings gotta be held accountable.
Yeah.
You shouldn't be wanting to go out to eat, you shouldn't be wanting to go put your fingers on everything, in jobs. Get what you need, get out and go home.
Yeah.
It's,
Yeah,
That's simple.
each person here has a responsibility, I'm going crazy with us all in here right now,
Yeah.
right?
So Bobby Meehan again, I think that in the beginning, Teresa, you had mentioned that the federal guidelines also included churches, but the handout does not say churches. Is that something that you will recommend, add to this, or?
Yeah, I was actually, when, I was gonna ask about that, I think that there have been some discussions about churches and that,
And
but,
some of our churches, I understand, have already done that on their own. And I don't know that, I might have said that wrong. As far as the churches go, Lewis and Clark, I got information from them, and, they added churches to theirs. Because that's, a huge place where people congregate. And so they may have done that on their own.
Is that something that you'll consider putting on this resolution?
I would definitely, if we can, I don't know what churches, if there's some other legal issue of us saying that someone can't meet for religious reasons, that is above my pay grade, but if that's something that we feel like we can, absolutely. Same thing with, there are exempt activities that can occur that are exempt from us licensing, like the St. Patrick's Day event that the American Legion wanted to put on Sunday. They're exempt, and so technically they can have those, and so we would also want to limit any of those kind of activities from occurring, so.
Yes, Nicole?
2 more questions online. The first one, this is coming from Wilma Flintrock, asking if the one confirmed case, the woman who has not been here since November, and is she currently back here in Townsend? Not sure if this is,
I think it's confusing.
That's it.
My understanding is that she is not in Broadwater County.
okay. Second question, this is coming from Nolan Lister. How many tests have been conducted locally to date?
Oh, let's see, I have that information. I only have the Montana information, from Heather. So there's been 509 in Montana, 499 that have negative results, 10 with positive. That's the whole state of Montana. As far as I know, I wanna say that we have had 5 or 6 that have been tested in Broadwater County.
If I can. I think there's a sort of, and maybe Teresa might be able to answer this a little bit better, and for people who can't see me, it's the Sheriff Meehan. But there's only, we got 1,000 test kits yesterday. We only had 850. And I think that people get confused or there's some misunderstanding. that just because you display symptoms, not necessarily doesn't mean you're gonna get tested. And from what I was watching it yesterday on some news, is that they're testing for the influenza first. And if they come back for a positive influenza, they're not going for the coronavirus because they both display the same symptoms. And the true false are different, but just because you have a fever and a cough doesn't necessarily mean you got the coronavirus. We still have a flu bug that's quite rapid here in Broadwater County. I think people need to understand that and not go to the far right side of the world saying that's coronavirus. But there's people, if you don't fall within a demographic, I think there's people that aren't being tested. I've got some friends where their children are 19, 20, 21 years old. They've got a cough, they've got a fever, but they're not being afforded the opportunity to test for the coronavirus, period. Because they are in a healthy demographic of society. So what I think with a lot of these tests, because they're a limited amount, they're all going to Helena to be tested, High Patrol's running those tests all over the state, is that a lot of these are, if you have an underlying medical condition, you fit within a demographic that's going to be a mortality rate is a lot higher, that's where those tests are going to. There's 1,064,000 people in the state. We had 1,850 tests total. So not everybody who comes down with a symptom is going to get tested. And I think that's something that people need to understand, is that they're going to shoot for the influenza, you come positive for that. We're not going to go down the coronavirus thing because they do display the same concept. So that's what I understand from what I'm reading, from what I'm getting from the CDC, from Homeland Security, from the federal government, and all the other people that send me all the stuff in the world. So I think that's some miscommunication, misinformation is being displayed, that just because you come up with a fever and a cough, you're going to get a coronavirus test, and that's not happening. So I just want to put that out there.
So not only are people just initially being tested for influenza, they're also being, having a respiratory panel, which has 12 respiratory viruses. And so even the state has a program, if your insurance doesn't cover it or you can't afford it, the state will run those tests. And that tests for 11 or 12 respiratory viruses, including the other coronavirus tests. So you have to go through that before you get tested for the coronavirus, just due to the lack of test kits that we have.
Yes, Nicole.
Question from Lisa Ulmer Christiansen. Can a beauty salon remain open if it's a one-person business? Only the owner is working there and one customer at a time.
Yeah, we're not limiting that activity right now. And there hasn't been any recommendations from DPHHS or the CDC to do that at this time.
Any other questions or comments? Yes.
Betsy Kitchener. So what about the small businesses in town that don't have anything to do with food or alcohol? What do you know, we've been talking about all the restaurants, bars, casinos, Bob's, Chow Pump. Those are all food-related or alcohol-related businesses. What about the other businesses in town that are not food-related whatsoever? You know, I mean, my mom's Creative Closet for one, it's a quilt store. JL Wright's is another, you know, craft store. The hardware stores, like, are we gonna be restricting access to those as well during this, you know, to
So
the
the
drugstore?
recommendations has been to not allow congregation of people, you know, to allow people to get together in groups of more than 10. Restaurants, bars, casinos are the first line of where we can look at that. We still want people and hope that people will take responsibility for themselves to not congregate in those facilities. We have to start somewhere. The CDC and the state have given us recommendations for these. Once again, tomorrow we could be right back here saying stores, all stores except for groceries, or, you know, or whatever. We could be right back here.
So the guidance for those things are the same. It's 10 people or less and 6 feet. So, you know, people have to take responsibility for that. And I think most of our business owners would be, you know, responsible for, you know, saying this is how it is right now, so, you know, we can't get 15 people together to sew quilt, you know, in close quarters. That stuff has to wait, but If you need to come in and buy material, you're good to go, so.
I just figure, you know, we're all gonna be stuck at home for a couple of weeks, so that, somebody's gonna be working on their truck or making a quilt